like everything else I really do, we always start off with a little bit of anatomy, a little bit of physiology. So you think about the nervous system's broken into two parts. You got a central nervous system, which is the brain and the spinal cord, and then the peripheral nervous system, which is all the external nerves. All right. Um, the spine is protected, of course. The brain is protected in the skull, the calvarium, and all that stuff. The spine is protected by the vertebrae that's going down. And at what level? Where does the spinal cord stop? At the butt. Okay, where specifically? What level does it stop at? Actually, it stops higher up. What? Lower lumbar? Nope, keep going up. The actual spinal cord, it stops at, the lower thoracic, upper lumbar. So T12L1, L2, that region. That's where the conus medullaris is. Everything from beyond that, the horses or the cauda equina, which is called the horse's tail, that's the lower portion that goes through. It's still in the spinal column, but it's not technically part of the spinal cord. Peripheral nervous system, we have 43 nerves originating from the CNS. There's 12 in the thoracic. You'll have 8 in the cervical, 12 in the thoracic, 5 down in the spinal column or the lumbar region, both sides, and maps out from there. Spinal nerves and all that stuff. The nervous system, again, going up top, you have the discussions back and forth, or the communication between the spinal cord and the brain. And then from there, you'll have from the cranial nerves, the 12 cranial nerves. If you don't remember those, that's on an old Olympia, Tiny Tops, a in German, viewed some hops. If you've never learned the cranial nerves, it might be a good idea, because part of doing your neural assessment is knowing the cranial nerves. All right. And we'll briefly go through that stuff, not much. Spinal cord and all that stuff talks with the spinal nerves. And then between the cranial nerves and the spinal nerves, you have the autonomic system, which is the involuntary. This is the control, your breathing, your heart rate, your digestive system, all that stuff, okay? If you're a blonde or something like that and you're trying to control your breathing, you would die. It's that one blonde joke. All right, versus the somatic, which is the voluntary or your motor nerves. We control how our arms move, except at nighttime when we do the involuntary twitching and all that stuff. And then, of course, the final portion of it is your sensory nerves. Inside the calvarium or the skull, we have 3 different things. You have the brain itself, you got the blood, and then you got the cerebral spinal fluid or the water. All right, that's going to be your oil lube for just like the motor engine, all that stuff. Brain's mostly water. It's like 85% water. And then from there, the blood coming in, 3 major branches. You have the carotids coming up, and then you have from the back of the brain, you got 2 vertebrals that come together to form the basilar artery. Those are predominantly the 3 major branches of the arteries coming into the brain itself. And then you have multiple capillaries, sinuses, and all that stuff. The cortical veins and the dural sinuses. And once again, all the sinuses is a collection of blood, just like we have in the heart. All right, so located in the ventricles, cerebrospinal fluid, and then all the extracellular and intracellular fluid. That's predominantly where all the water is located. The brain itself, made up of different lobes, actually has different parts. First of all, the cerebrum. If you think of Professor X and all that stuff, you have the 4 different parts of the cerebrum. The frontal lobe, this is predominantly our thinking portion of it. The parietal and temporal lobes are getting into the sensory and emotional sides. And then the occipital is more the vision, where that's the major neurons and all that stuff are located in the occipital. The pons, medulla, and then the spinal cord. The pons are the brainstem. These are the control centers for the majority of the autonomic system. Our primitive reflexes live there. So if we kill off the cerebrum, we can still survive because of the brainstem. And the cerebellum is the location of our ability to coordinate. So if you think about the brain, left and right, it's actually, this is a CT representation. So the right side is actually on the left side is actually on the right. So the left side of the brain is all of your touchy-feely, lovey stuff, versus the right side of the brain is our math and our, so if are you right-brained or left-brained, depending on all that stuff. Some people are both, not like me. All right. Functions. Again, this is going to be the temporal lobe right here, the frontal, the parietal, and then the occipital. Just looking at that. Two different fissures, and a fissure is just a place that separates the lobes themselves. So the lateral fissure, and then the central. The central fissure is a major one because it actually splits the premotor cortex and versus the presensory cortex. On the next slide, we'll talk about the homunculus, or the little man, and the little man sits right in this area. The lateral fissure, this is your Broca's on the left side, Broca's in, which is your speech, and then the Wernicke's and all that stuff, or the Broca's and the Wernicke's, which are your speech and your hearing locations. All right. So the homunculus of the little man, I don't know if you guys ever seen this before. Most people aren't. So if we split the brain front back, basically how our nerves and our bodies feel things. Our feet sort of hang over on the inside, the middle portion of it. So we have, excuse me, little feet, small legs, small arms, big hands, okay, because that's really for sensation and movement, a lot of that. A lot of sensation and movement in the face, we can pretty much touch and taste and smell and all that stuff, which is on the more the lateral aspect, and of course, big mouth for some people. And then the last piece is actually the genitalia. So big penis and vagina for sensations and all that stuff. All right, a lot of sensation, a lot of movement and all that stuff down there. So pretty much the biggest, when we get into the neurologic stuff, it's really affecting of blood flow, okay? So if we stop blood flow to the brain, that's where most of the damage is, either through hemorrhage, through blood clots and all that stuff, which we'll talk to in a little bit. So structural damage can have problems. We can have circulatory changes, the clots and all that stuff. Increased ICP. I take a baseball bat and smack you in the head. You know, you're going to have some, just like a punch in the arm, it swells. That's where the ICP increases and all that stuff. And then we lead to the two pieces of controlling, and this will be pretty much the last of the Neuro Anatomy review. So for those, it's quickly through all that stuff. So the two things that we kind of sort of control the neuro with are the two neurohormones are glutamate and GABA. GABA is the gamma-aminobutyric acid. GABA is the stop, all right? So if you want to, in some of the chemicals that we give to some patients to calm them down, kind of sort of affects GABA. So GABA is the inhibitory, which is actually everything, and then glutamate is the excitatory side. It revs everybody up. All right. Questions on any of that? All right. And then, of course, they both work together for the brain control.